Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. Excited for today's show. Always love it when doctors come on the program. Let me get this introduction done right now. Dr. Hariri, say hello to everyone.
Hello, and thanks for having me.
Yeah, it's so grateful. Thanks for sharing. Always appreciate when doctors come on and help other doctors grow. So we're grateful for that. Let's just jump right into that first question we always ask. What made you become a dentist? How'd you get involved in dentistry?
Yeah, my mom's a dentist. So I grew up in the dental office. And then when I was 8, I fell and I had a vertical root fracture on number 10, which is like kind of your lateral incisor right there in the front. And so that as a kid, you go see the root canal specialist, the endodontist a couple of times, a treat and then a retreat. Then I go see the oral surgeon to take out a few teeth. Then I go see the orthodontist. And by the end of this whole thing, I met my mom and all of her friends. And I had such a great time with all of these kind gentlemen who treated me as a kid that I decided that I wanted to do that when I was older. And also I wanted to go into business. That was my passion. And my parents very much steered me towards medicine or dentistry. And so in dental, the dentists themselves become entrepreneurs a lot of the times. And so that's where another reason why I selected dentistry.
Yeah. And so some dentists become entrepreneurs, obviously, and some take it to a whole nother level. And I think you've done that. We'll talk about that in a little bit. How'd you go from sharedpractice.com? How'd you go from transition of practicing dentistry to helping other dentists the way you are now?
So I actually started with shared practice when I was a third-year dental student. So I was having a kid, and so I took some time off of school. And at the time, the individual who started shared practices was needing help. And so I kind of came in to assist. And I've just had a lifelong passion for business. And then when I became a dentist, it really turned into practice management. So shared practices has been that outlet for me. I graduated and I practiced dentistry for 2 years. And then COVID was a wake-up call, I guess you could say, for me, where it closed down the office. And then it was really hard to go back, honestly. I was so excited about the work I was doing at shared practices that I didn't want to go back. And eventually I went back after we were told to go back from our break over COVID. And then I put out an ad for a full-time dentist. And then when I told my team, as I said, George, the owner, is firing George, the dentist, and is going to remain the owner, but is no longer going to be the dentist. And so then I brought a full-time dentist to replace me. And that was in the end of 2020. So I've been non-clinical, but still using my degree in a different way since then.
Yeah. So I bet you there was a little bit of kicking and screaming for George when he had to fire George. And there's probably a little kicking and screaming when George got fired by George. It's probably a difficult thing to do, wasn't it?
Honestly, George, the dentist, wanted to go.
Yeah?
So I think that, it got to the point where I was like happy that patients would cancel or not show because then I didn't have to do the visit. So it got to the point where honestly, I felt like I needed somebody in there who wanted to drive production, who wanted to be busy, who wanted to have their schedule full. And so I think it was the best thing for everyone involved.
Yep. So give me the elevator version for those that are not familiar with shared practices and what you guys are doing there. Give me that quick 1 or 2 minute version of what you guys are doing.
Yeah. So 2016, the Shared Practices podcast began with a simple mission of filling in the void that dental schools leave on teaching dentists how to get into practice ownership and then succeed in practice ownership. And so the podcast took on multiple seasons like a Netflix show. And I came in during season 2. And we've sort of made it our mission to educate dentists on practice management. Then iteration came from there is that we developed our own practice management philosophy, which you'll hear dental Moneyball. We have a lot of different terms for it, but it's an analytical version that sort of accelerates practice growth. And then most recently, back in 2022, we started Shared Practices Group, which is a DSO that we formed on behalf of the company, and we're very focused on dentures and implants locations. So we have 44 locations that do just dentures and implants, 46 total locations in our platform. So started as a podcast, became practice management coaching consulting around analytics driven growth. Then we started a DSO where we're very focused on full arch and helping patients with what we think is a really transformative type of dentistry, which is all on four.
Yeah, I love it. And we could talk about this all day. I mean, that's pretty amazing and pretty exciting. I think a lot of listeners are going to want an answer to this next question. What's the biggest challenge that you see dentists and practice owners having today? What do you see?
Yeah, it's great timing. So I'm actually in the middle of writing a book called Dental Moneyball Zero. And as part of that, I took it upon myself to actually really research the answer to this question. And I think that there are a few things. I think you're going to see there's a percentage of practice owners who are making less than they were as associates. I find that to be one of the most interesting things that I've learned in my research. The other thing is you're going to have hygienists, and everything around the hygiene shortage in our industry is a huge impact, and also going to be getting worse because we have a lot of the workforce that's left is older and soon to be retiring. And so the states are going to have to figure out what to do because we do not have enough hygienists for the number of patients who need their teeth cleaned. And that's a problem. Sure. And then I think it's competition and patient flow. I think HR, I think dentistry in general is like a very HR intensive profession. And so a lot of dentists have common pain points with the amount of human resources that they have to, how much time they have to spend managing their teams, hiring, training, firing, performance management, all of those things. And so I would say those are probably some of the biggest challenges facing private practice dentists today.
Yeah. So can I pick one of these to dive into?
Please.
Yeah. So let's talk about competition. So people know that I'm on the marketing side and I help dentists on that side, private practices on that side. On the competition side of things, what are some things that are outside of the box that you can share, some secrets that you can share on ways that practices can beat their competition?
So I'm actually going to go outside of the box and answer your question differently. So I think that oftentimes, like when I was a dentist trying to figure out marketing, I sent a mailer with myself missing a tooth. And I thought it was like an out of the box idea to get new patients. And I think that a lot of dentists try to think of these out of the box ideas to get new patients. Honestly, the best way to get new patients is in the box, like the things that we know work predictably and like doing those consistently. And I think the importance of repetition of marketing, and like I was under the belief that you just spend money on marketing, you get patients, and it's like a very straightforward exchange. Right. But in fact, it's like there's a build-up period. You have to keep marketing consistently for a period of time before you get the full effect. Right. And so it's like picking a sound strategy that has data behind it that shows it's effective, and then executing that strategy without stopping for a long period of time. Like I think that it's not out of the box. I actually think the out of the box thinking is like what I would not recommend, and like maybe recommend people being more rigid to the things that we know work.
Yeah, I couldn't agree with you more on that. I think right now we see this, and I know this will alienate some younger listeners. Well, I shouldn't say younger, just listeners in general, that people like this really boutique-y style practice is very popular. And they're also the ones that we get the most amount of calls from that are struggling, that their hygiene is full, but there's no treatment. And I'm like, well, because you're attracting patients that need no treatment. Like you're attracting younger patients who grew up with helicopter parents and fluoride and are college educated, and they really love that boutique-y kind of style. They like that Beverly Hills kind of look and feel, and they're attracted to it. But guess what? They've already had ortho, right? They had ortho when they were 12 and then again when they were 15. Like they don't need the treatment. So I think that's a really good point. So if people want to learn more about shared practices, what's a good way to do that? What's a good way to get in touch with you guys?
Sharedpractices.com is a great place to start. We have an overview of all the different things that we do there. I think we're probably most well known for our work in helping aspiring owners. So if you want to become a practice owner, we really help people get into ownership via acquiring an existing practice. And so if you find an opportunity, we do a free look. And then we're very well known for our buyer's representation services, which do a combination of looking at the practice management opportunity as well as the financials of an opportunity. And then we're also very well known for analytics-based practice coaching. So then when you get into ownership, or if you are an existing owner, we help people grow their practices using practice management analytics to identify where your effort is going to be the best spent, where you're going to get the most growth. And then we work with your team to help you realize that growth. And in doing so, we've been very fortunate to grow over 100 offices per year by 37 to 39% year over year for the last 4 to 5 years now. So we have a lot of data behind our methodology, and we're very consistent in being able to grow dental practices.
Yeah, I love it. I want to promote the site one more time, sharedpractices.com. Free practice assessment, top right, and then also podcast.
Yeah.
I'm looking at some of these titles in this Practice Underwater, how an $8 million multi-location gains clarity and reclaims control. I think there's tons of practices, even that are at the $500,000-$600,000 a year, that are the dentist is really struggling to control the practice and the business. So I think that's an episode you got to check out. Check them all out. I'm going to ask you another question. This is a curveball, so I know that you're not prepared for this. So I apologize in advance to doing this to you. What do you see coming? How do you think AI, and I know these are really guessing, but how do you think technology and AI is going to change dentistry in the next 2 to 5 years?
Oh my gosh. Yeah. I mean, AI is coming for, in the immediate future, all of the things that we do that are clicking around on a mouse or calling people and asking questions, or any of these things that are just people doing administrative work behind a computer screen. AI is coming for that stuff so fast. We're going to be really surprised. I would say in 5 years, it's going to look completely different than it does today. I would say today, I don't find the AI tools are really ready to replace humans in a meaningful way, barring a few applications that have been nailed. But like for the most part, I think that it's not there yet, but I think it is coming for sure.
Yeah, it's going to be interesting to see what happens. I love asking business leaders, thought leaders that question, because it's going to be crazy. We're going to have to see what happens. So one more time, the website is sharedpractices.com. Thanks so much for coming on and sharing today. We appreciate it.
Yeah. And can I add something about the AI real quick?
Of course. Yeah.
Yeah. So I think the thing that's really interesting about AI is that it's one of those things that like we're going to see it, and it generally should benefit the practice owner, right? So it's like a lot of the good things that are coming from AI, it should be the real benefit. I call it the golden way of our next generation of entrepreneur, is that they can take advantage of AI and they're not going to be as reliant on humans doing work as we used to be, right? So that's going to be, I think, generally really good for the industry.
Yeah. I think you're absolutely right about that. Thanks so much for sharing. We appreciate you. We want you to come back on sometime soon.
Yeah. Thanks for having me.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.